And while we're on the subject of spending money, the October Household Affordability Index, which tracks food price data from 47 supermarkets and 32 butcheries in several cities around Johannesburg, Durban, Cape Town and Springbok, shows how food prices for an average basket jumped month on month. An average basket cost rising by 141 rand and 81 cents, and year on year just over 500 rand. And the foods which are more expensive today include rice by 5%, potatoes by 40%, eggs 19% and tomatoes by 11%. Food prices jumped most in Johannesburg, recording an increase of 285 rand month on month and 619 rand year on year. Pietermaritzburg Economic Justice and Dignity Organization's Mervyn Abrahams joins us now. Mervyn, good evening to you and welcome. We shared a snippet there of what the picture looks like, but it seems on most of the basics, even butternut, spinach, apples and margarine, there have been increases. Share with our viewers how basic this basket is for the average family in South Africa.
So good evening, Imani, and good evening to all your viewers. Yes, the food basket that we track consists of 44 very, very basic foods, as you've mentioned. It's things like maize meal, bread, margarine, eggs, chicken, potatoes, onions, etc. So there's no luxury in this basket. And this basket is constructed for a household of 7 persons. Sure. And in this month, over the last month, we have seen the basket increase by 141 rand, bringing the cost of this basket in October to 5,297 rand. Now that is way above a national minimum wage, which would have brought in for a worker something in the region of 4,600 rand. Now that's just food alone, Iman. Our research also shows that it costs about something like 1,584 for transport for a worker to work, and roughly around 980 rand for electricity, for 350 kilowatts of electricity. So that leaves about 1,983 rand left out of this national minimum wage. And if that is divided amongst 4 persons, then it just takes us to just over 400 rand per person per month for food, whilst the basket stands at 5,297. So that paints the picture of the difficulty that ordinary working class and poor households have to access sufficient and nutritious food.
What concerns you the most, Mervyn?
So really what concerns us is that the core foods, the foods that women say they must buy. So for instance, potatoes. We've seen the price of potatoes increase by something like about 41 rand over the last month. Things like rice has increased by almost 8 rand and 60 cents over the last month, eggs by 26. So these are the kind of basic foods. Now, if households can't afford that basic foods, then we are likely to see an increase in household food insecurity and possibly hunger across the country.
Yeah, saying insecurity belies the fact of the worry that creates. You talked about the malnourishment that it creates, and all of these have, other impacts, not being able to concentrate at school or work, and also trying to look in the budget for where else you can cut. And as you look at it and talk to these families and do these measurements, is there anywhere feasibly they can cut?
So really, households cannot cut any longer. We've had COVID. There is no belt to tighten. And I'm surprised at how economists and financial advisors are saying, live within your means. I mean, for the last 5 or 6 years, South African, working class South Africans and poor South Africans are not able to cut back on anything. The only thing they're able to do is to cut back on the amount of food they eat. And then, of course, there are these other difficulties that then emerge, as you've so correctly said. So there will be an increase in terms of the need to go to hospitals, our health, we will be more exposed to disease, our educational outcomes will perform worse, our economic productivity will be worse. So these are all the consequences of households not eating properly. In fact, our economy, human dignity, is built on the presumption that we are able to eat at least a sufficient amount of food. And that we can't even guarantee in South Africa anymore.
You know, as you describe it and you go through all of these things and you say there's not even a belt left to tighten, in fact, this is not even including all of the other things that in quote unquote, normal families or middle class families would be able to afford, like toiletries, things to take care of yourself and your body. You're having to forego all of these things because you're making the choice between, an egg or a piece of bread or perhaps even some milk. How, again, is there any room for people to buy things like that in this average basket to at least take care of basic hygiene needs?
So we also track a couple of essential hygiene products. And there we have seen also massive increases over the last few years. And what it does is exactly as you say. Women tell us that they now have to make a choice between buying soap and buying something to eat, because the hygiene products actually compete in the food basket, in the shopping experience, with food that needs to be purchased. So one can well imagine the immense difficulty, particularly for women in South Africa, who require certain hygiene products for their basic sense of human dignity. And in that sense, South Africans are really living on the edge in reality.
Mervyn, thank you very much. It's always distressing. I never look forward to our interviews with you. And what I mean by that is just hearing again just how distressed a vast, swathes of South Africans are in terms of just trying to make ends meet. And we're talking here about people who might still have access to a regular job and a regular income, let alone those who are even more vulnerable and exposed without access to any of this. So again, we just appreciate the work that you do, and thank you for sharing the results of your work with us. It really is a big reality check. Pietermaritzburg, Economic Justice and Dignity's Mervyn Abrahams.